what we're going to do is going to get each GP to introduce themselves, tell us a little bit about their backstory, because I think that's going to be interesting and how they're at where they're at. Then we're going to explore some of their practice. We're going to talk about some of the black swan case studies that have popped up and where that's interesting. We're going to talk about the challenges of being in practice and doing this, and we're going to talk about the joys of doing that as well. So let's start down here with you, Victoria.
Hi, I'm Victoria Buntine. I'm a GP in Sydney. I have previously been an Air Force doctor, and then I did 15 years in Asia, 10 years in WA, and I'm back to Sydney 2 years ago. My experience with low carb started in the 80s when my mother went Pritikin after a doctor told her she had a cholesterol of 5.8 and went into a panic, and the whole household went on Pritikin, and I lost my mind. And I vividly remember it. I couldn't think anymore. I was a teenage student, and I went crazy. From that minute on, I knew that fat was really important in my life. Flash forward, had babies in Hong Kong and then wanted to lose some weight, and Atkins was around. This is the late 90s, and I thought, wow, makes so much sense. Then I got back to Australia, into Perth, and I was really passionately low carb, but really wanted to float under the radar, and so was very quiet for a very long time. Got back to Sydney, and thanks to Gary getting off, I thought, right, this is it. I'm coming out. And so I've basically been low carb for a very long time, and could never understand as a medical student why diabetics were taken off fat, not sugar. Just never made any sense. And then really I've landed in a practice of 26 doctors on the Northern Beaches in Sydney. Nobody knows me. They think I'm mental. And I put it into practice every day for the last year. I'm a full-time single mother working GP, so I see 30 to 40 people a day, and I bring it into every consult. And it's exhausting, but it's really life-changing, and it's amazing that people just, never really get asked what they eat. And so I won't unsee it, and I won't change now. I'm committed, and here I am. That's it.
Do you bring any? When my boggles with 26 colleagues and presumably practice nurses and administrative staff as well, how does that even work? And the second to that, do you feel ostracised for some of the stuff, or do you bring anyone with you ever, and how? If so, how?
No, I feel completely ostracised. I sit in the drug lunches every day as we get more and more biased information about this new diabetic drug or that, and I just say quietly, how about we take them off sugar? And they just look at me and no one says anything else. I send them all emails saying, why don't you come to this low carb down under event in Sydney? One person mentioned something about it in the corridor, but that was it. And I come in, when I look at the lunches, I'll just pick a roll and take the bread off and eat the bit in the middle, and yeah, they think I'm weird. The main problem actually has been when I'm away and someone else is checking my results, I have to go recheck them. I have to ask that they don't, because fasting insulin gets missed all the time because of the guidelines. They don't specify that anything over 10 or above is abnormal. Triglycerides are ignored. I mean, it's just a bit of a nightmare, really. But no one really knows. The patients that come in, they're really not mine. I haven't been there long enough, and but they're really receptive, and I just keep going, and I try to be gentle with it. I'm not always gentle, but I try to be, and they seem to be coming back, so that's nice.
What's your hope in using David Unwin's thought of the best possible future in that clinic? What would it look like in 10 years if everything went?
Oh, it'd be amazing if some of the others said, wow, we what do you tell patients? Or they came to something, or I guess I can see my patient base is building quite nicely, and they're definitely telling their friends, oh, you're the keto doctor, or whatever. I don't know, I guess just, as I see it, I'm really just a worker bee. I chip away every day at grassroots level. There's no incentive really for me to do that. It's harder work than just being a normal GP, and that's hard work in itself. So a typical patient would come in with 3 to 5 things on their agenda, and when I talk to when I'm dating, which I am, I go, imagine that you've got 30 to 40 back-to-back meetings, and you have no idea what the agenda is, and there's 5 things on it. This is my life. And then we do their 5 things, and then I go, okay, well, actually, there's a few things I want to do. So it's really exhausting. And halfway through my little bit, which is like a few minutes at the end, sometimes I say, look, this is exhausting for me to do this, but I actually really care. And I have struggled a lot. A few years ago, I lost my son, then my dad, then my mum, all in 3 years. And as a single mum, I had to get back into work, and it was really hard to find any joy in the day. So for me, this has just really given me some kind of purpose.
Thank you for letting us into your world. So, Jackie.
Hello. So for those who don't know me, I'm Jackie Montefiore. I'm a GP based in Brisbane, and prior to my life in medicine, I used to be a dietitian. So I was an APD, and I worked for a few years in a weight management clinic. So I was very much schooled in the calories in, calories out, limit saturated fat to reduce the risk of cardiovascular disease, and that's what we were taught, and that was the paradigm that we used certainly in my dietetic practice. But what I noticed with myself as I was kind of getting older and into my 30s and through those is that I was personally starting to gain weight myself. And I noticed some funny things, like I would try and reduce my calories and exercise more, and I would get what I now know were reactive hypoglycemic episodes where I'd feel really, shaky and hungry. And I think, I was developing some of those early hallmarks of insulin resistance. And in fact, I was very, very close to being diagnosed with gestational diabetes myself during one of my pregnancies, and put on a ton of weight, and over 20 kilos, and then I stopped measuring because I was so mortified with how much weight I was putting on. But then after having the baby and then trying to get my own weight under control and just thinking, like, this is ridiculous. I have dietetic background training. I've worked in weight management clinics. If anyone should know how to do this, it should be me. Yet I was joining online personal trainer kind of weight loss programs, some of the famous ones you probably are aware of, and just feeling starving throughout that whole process of eating a calorie-controlled diet. And what kind of really piqued my attention with the low-carb, high-fat was hearing about Gary Fettke's issue with APRA, and it just, elements of that piqued my interest enough to want to look more into it. And so that then led me to his website, and then which led me to the Robert Lustig sugar lecture on YouTube, which was like mind-blowing. We never learnt any of that in dietitian school. And yeah, then Nina Teicholz's book, and then eventually Gary's book as well, and it was just mind-blowing for me. But I was still fairly sceptical, so on a whim, I just decided to try the practices myself. Just, again, on a whim, when I was on holidays with my family in Noosa, I just thought, I'm just going to try and not have toast for breakfast with my eggs and bacon, and, limit the refined carbs, and felt absolutely rubbish, with the keto flu in the beginning, because I hadn't researched enough about salt and fluid and everything. But after getting through that, just found, amazing increases in energy and control of hunger, and excess baby weight just dropped off me effortlessly. And so then coming back from maternity leave, I thought, I definitely have to help my patients incorporate this into their own health plan. And also wanted to...
Hang on, because so when you're transitioning, are you a general practitioner, or are you still a dietitian?
No, sorry. I had gone to medical school, and I was a doctor. So it was after medical school that I came across.
So hang on, what even motivates someone to go, hang on, I'm a registered dietitian here practicing, and now I'm actually going to go back to medical school? That's a big decision.
Oh, yes. Well, it's not uncommon. There's quite a few dietitians.
Hey, I'm not criticising it.
Yeah, no, I'd always been interested in it. Yeah, I mean, a lot of medical education in Australia is postgraduate anyway, so you need to have done a degree anyway. And so there's, physios that go back and do med. And so, yeah, I just had always wanted to do it and always had an interest in it. And yeah, ironically felt like I could do more to help patients using medications, whereas I've come full circle and realised it's more you can do with diet. So yeah. Maybe I needn't have done it.
What do you make of that?
Yeah, well, it's fascinating because even as dietitians, it's kind of, underrated the power that changes in diet can have on our patients' health. And we sort of have this, defeatist mentality sometimes when we see these people come in, quite overweight with type 2 diabetes, and you sort of see them in private practice and you're thinking, oh, no, none of this is going to work. And anyway, have your whole grains during the day and yes, we'll see you later. So, yeah, it's quite fascinating to realise, no, actually, you can reduce the grains and sugars and not be fearful of the natural fats, and these people get a lot better. And like so many people have said, you just can't unsee what you see once you do that, despite all the resistance we get.
So what does a day look like? How many patients are you seeing, and how does diet fit in to the everyday practice of general practice?
Yeah, so I started my own practice as like a low carb kind of clinic, and then this year I've evolved it to include more GP services as well, for a few reasons, and I've spoken to some of the other low carb doctors about the pros and cons of doing that. But, so my practice is fairly new, within quite a heavily populated inner city area. So it's gradually building up, but slowly over time I'm, kind of finding I'm seeing the sort of people I want to see, which is really good. And I feel really privileged to have a really engaged group of people, of patients. So yeah, does that end?
But do you work are you doing 10-minute appointments with Medicare bulk billing, or are you stepping out of that?
No, well, I have structured the way I run my practice to be slightly longer appointments. So there generally is, an out-of-pocket cost to come in, just because of the way Medicare is set up. It's set up to kind of, if you're just doing consultations, to churn through them quickly, and the half-decent rebates are if you're doing more procedural sort of stuff like skin cancer medicine. And so, there's like this sort of quality balance you have to go, and it is really hard to discuss some of the intricacies of diet and people's psychology behind that within 10-minute appointments. So I'm just personally not adopting that model myself.
And so if you, stealing again from David Unwin, looking 10 years into the future, what's your hope for the practice, and what's it going to look like? What's the best possible future?
I see a big role for having that support to help people adopt the changes. And so I think, that like what Jess was talking about with the delivery of information to people and how we support them, I just think is so important, because it's one thing for people to know what to do, but at the end of the day, we still live in a high carb world, and it can be difficult for people to stick with things in the longer term. And so I actually like the role of having health coaches. I think that's a really interesting model that's been embraced a bit more in the US, and I just see that as a way forward, as being able to support people and give that people some accountability, but make it cost effective to the patient and the system. So that's what I would sort of model I'd like to see in my
So your practice would also have a number of health coaches who saw patients, but that you oversaw the whole lot of it?
Pretty much, yeah.
Cool.
And because they've got their set of skills that they're much better at than me, and then I guess it frees me up to try and do less of the health coaching per se, and do more of the medically managing them and adjusting medications and medically supervising them.
Cool, thank you.
Welcome.
let's zip across the continent to Perth with Joe.
Thanks, Grant. Joe Kosterich. I'm from Perth. Obviously, we had a bit of a chat before, and Grant sort of said, look, one of the things I'll ask you is, how did you get into this space? And it's a really good question because I just tend to fall into spaces. I don't actively seek them out, I don't think. The only sort of theme that I can really see through a few of the areas that I'm involved with is that the more people try to impose something and more resistance there is to change, the more I think there's something wrong. And if there's something wrong, then I'm interested to find out what's wrong and what can be done to change it. So if I really think back, probably in around about 2003, I think it was, I heard a lecture from a couple of American guys who were from a group called the American Academy of Anti-Aging Medicine. And look, some of what they said made sense, some of it I wasn't that fussed on. But one thing they did say, which really did strike a chord, was that said really the role of the GP is to help people be healthy rather than just treat the disease. And well, that's fairly obvious. That's not something we really seem to do a lot of. And that, I suppose, sparked some discussions with other people and morphed into a business that we looked to set up that didn't sort of set the world on fire. And then morphed into me writing a book about 10 years ago on how to be healthy and stay away from doctors, which is still available if anyone wants to buy a copy. Still got a few left. But really it became more and more that health is not about what doctors and medicine does. It's really about what individuals do. We have in this country, in fact in all of the Western world, we don't actually have health systems, we have disease systems. And that really the more things can be devolved back to the individuals can be empowered to basically be managing their own health on a day-to-day basis, but with useful rather than not useful information. That was really to me the way forward. So look, I had a newspaper column in those days, and I used to sort of push that idea, and it was sort of put to me, well, you could convert some of these columns into the beginnings of a book, and so it went. So the idea was, yes, I could sit in the consulting room and say the same thing one-on-one to people day in, day out, and that certainly has a role and a value, and I think there are people who are much, much better than that than I am. And they're sitting on this stage, probably my skills of being able to talk to the many. So book, I've got a spot on radio and on TV, and I can use those platforms to, I suppose, talk a broader message. And part of it also, I think, is very, very much keeping it simple. I think a lot of these things are made harder than they need to be. So it is about evolving, well, what can we do to assist people that may make it easier for them? So if I want to go local, what can I do? Well, I go to the supermarket. Well, how about shopping around the outside of the supermarket? Avoid the middle aisles. Is it a purist thing? No, it isn't. Might it get you 85% of the way there? It might. So for me, it's really about people being able to manage their own health, and rather than be, I suppose, as Pete Evans says, a victim of the system. It's all their fault. They've done this to me. They need to fix me. It's about the individual being in charge of their own health. What I do day to day, what I put into my mouth, whether I move my body, whether I manage my stress, whether I get enough sleep, how are my relationships going, what do I do to enjoy myself, that is really to the individual, and there's no pill that's going to fix that. So I suppose, I don't know if I've answered your question.
I didn't even hang on, just step back here, because I didn't even actually ask you a question.
But essentially, it's really what can one do to help people in their own lives? Because the problem we have, and I think it was well highlighted by David Unwin this morning, is the medical system has come to be dominated by elites sitting in ivory towers looking at papers who never actually deal with real people in the real world. And it is the clinicians, and that includes doctors and dietitians and physios, and a whole host of people every day who are actually dealing in the real world with real people, not dealing with theory and associations and statistical probabilities. And they're the ones who see the effects in the real world. And if we look at the real world, we can see that since the introduction of the low-fat dietary guidelines, there's been an explosion in type 2 diabetes and obesity. But nobody in public health wants to look at that. And it's just staring them all in the face. But they're so committed to their egos, and they're so committed to their government funding that they won't admit error. So I see it as my job to rattle the cage.
All right. So I've finally got a question. So I just want to tell you about a study that one of my doctoral students just completed, which I think has got an interesting thing in your context. So we got parents 10 to 12-year-old children and doctors to do a bunch of things like sorting foods, which they thought were healthiest to least healthy, but also some health behaviours. And one of the health behaviours was going to your doctor. And what was interesting is both the parents and the kids, 100% of them rated it as very important. And we only got 50% of the doctors rating it as even important. They're going to your doctor. What do you make of that? So the public are saying it's a very important thing for my health, and the doctors are going, hang on, no, not so much.
Yeah, I think that sort of inside knowledge is always very valuable. I think people have been conditioned, as soon as you stub your toe these days, it could be cancer, you've got to rush to the doctor.
Yeah.
You've got a vague little bit of a sensation in your little finger, you've got to call the ambulance, it could be a heart attack. There's been all these messages pushed out to people that every single thing that can possibly happen to you must have a medical cause and therefore a medical explanation.
And could be resolved by your doctor, which is not most.
And I suppose people have been told this over and over again in so many different ways that, I think there's a belief in it. And I think people inside the bubble actually know that that's not the case. There is absolutely a role for medications. There's a role for medical practice. If you run over by a car and you've got 3 broken bones, they're probably not going to heal up by themselves if they're out of alignment.
You're not going to meditate it back into shape, no.
If you have suffered a heart attack, then you probably do need medical attention. If you need your appendix removed, you're going to need to have surgery. But the chronic lifestyle-related illnesses don't do very well with medications, as we see with type 2 diabetes in particular.
Brilliant. Let's go to Susan.
Hi, so my name's Susan Swanston. I'm a GP in Cairns. I've been in Australia for 9 years now. I trained in the UK, and the first half of my career I was a vascular surgeon, and it was a stressful job, and I left and retrained in general practice because it was very stressful and it was making me very unhappy. But I often reflect, and I think...
Hang on, so what's the stressful, just for those of us who are not vascular surgeons, anyone else not a vascular surgeon? Just take us through the stressful bits.
So it's very stressful. I was on call on a 1 in 5 basis with prospective cover, so that meant when a colleague was on holiday, we had to cover for them. And if it was half term and the 3 of them had school-aged children, it left 2 of us on, so we were doing alternate nights on call. Vascular surgery is a funny game. There's a lot of emergency work. People are very antisocial and they rupture their aneurysms in the middle of the night. And when you get a call at 11 p.m, you know you're not going to get to bed that night, because by the time the patient's transferred, if they're still alive, you're going to have a 3 or 4 hour operation, and then you've got to settle them in ICU, talk to the relatives, and then ward around to 7 o'clock or 8 o'clock in the morning. There's going to be no sleep. So I was chronically sleep deprived. I had 4 colleagues who didn't know what the word team meant. It was a system of male rivalry, not team cooperation, which made it very difficult for me as a young mum with a small child. And then when I had the second baby and came back from maternity leave, it really became quite impossible. My consultant colleagues expected me to be available even when I wasn't on call. My husband was working shift work and I was in charge of a 3-year-old and a 6-month-old baby, and couldn't drop all and go to the hospital. So I was finding it just increasingly stressful and incompatible with normal life. So I was faced with leave, find another vascular post, which was going to be just more of the same, or retrain, and I took the option to retrain as a GP. The College of GPs accredited me with nothing, as if I'd never been a doctor, even though I'd been practicing for 15 years. So I had to start off with my colleagues who were 13 or 14 years my junior, doing exactly the same as they did for the full 3 years training, which was fantastic. The only perk I got was that I called the consultants by their first name. Now, if anyone here is from the UK, they'll know that there's a very hierarchical structure in hospital, and nobody calls the consultant by his first name, except possibly his wife or his consultant colleagues, and most people refer to him as God. Consultant colleagues by their first name, even though I was a junior doctor, so I was very privileged. Oh, the other thing I wasn't allowed to do was sign CT scan requests. Junior doctors weren't allowed to sign CT requests, but because I'd been a consultant, they made a concession in my case. So I did feel very privileged as a junior doctor. But I retrained in general practice, but I often reflect that maybe I would have practiced my vascular practice would be very different if I'd had the knowledge that I have now. Vascular patients are all arteriopaths, they all have damaged arteries, that's why they're there. They all get put on statins whether they need them or not. They all get put on aspirin whether they need it or not. Aspirin causes huge problems when you come to operate them because they bleed. And so I think back to my vascular days and think if I was doing it now, I would probably practice quite differently. Obviously, you still have to fix a ruptured aneurysm in the middle of the night. Low carb diet's not going to fix that. But you might be able to stop patients from getting their aneurysms in the first place. So when I came here, I worked in a big practice when I first came in Kent. Well, not as big as 26 doctors, there were about 12 or 13. And then 6 years ago, I went into practice with a partner, so a 50% partner in the practice. My partner's not on board with low carb. He either gets angry or mocks, depending on the mood. But sometimes he can be quite cooperative. But I suppose, like most people, fallen into the low carb space. I lost 20 kilos myself 8 years ago, a year after we got here. And I didn't do it by going on a low carb diet. I did it by eating less and moving more. But the way I ate less was I didn't eat the rice, I didn't eat the potatoes, I didn't eat the bread because I thought they were pretty bland and tasteless. And I actually preferred to eat the curry and the meat and the vegetables because they were tasty and they were nice. So I ate less and I did a bit more exercise. So therefore I lost weight by exercise. But in fact, of course, what happened was I went low carb, but I didn't realise that that's what I'd done. And then I went to a talk at my children's school 4 or 5 years ago by David Gillespie, who's been mentioned before. He's a lawyer in Brisbane, and David came up to give a talk called Eat Real Food. And I sat in his talk and I listened to David talking, and all the pennies started to drop at once. And I suddenly realised that this man was talking an inordinate amount of sense, and that this just made it fit. And of course I've lost 20 kilos because that's what I've been doing.
So, hang on, let's just get this straight because I'm interested. So we've got someone who's a former vascular surgeon, and then retrained as a general practice, and when the penny dropped is when you went to a talk at a kid's school.
My daughter reminded me of that the other day. She said, "Mum, if you hadn't gone to that talk, you wouldn't be doing keto." There you go. So that was the start of it. I also have a very good friend who's in the audience, and she's been doing low carb for a very long time, and she's been trying to convince me for many years, and she didn't really succeed, but then I have to say, I did have to go back to her and say that she was right all along. And it kind of went from there. I saw Low Carb Down Under advertised in Sydney a couple of years ago. I went down for the day for that. And I also, of course, having lost weight, patients would say to you, "Oh my gosh, you've lost weight." And so I thought, well, I got to thinking about it in that lots of people come and see a doctor and know they need to lose weight. And the doctor really helpfully says to them, "You need to lose weight." Well, yeah, that's pretty obvious. What the doctor never says to them is, "This is how you can lose weight." And I got to think, and I thought, there's no point in me saying to patients, "You need to lose weight," unless I could say to them, "And this is how you can do it." So that's really where I started to do a lot more research then. Through Low Carb Down Under, through... I read Gary Toad's book, actually, The Case Against Sugar, quite early on in the piece too, and I found that hugely convincing. And realised that that's, I think, where the bad guy is ultimately, and that we needed to address it. So now I run a fairly formal weight management program. The patients come, I see them, I then come back for a second appointment where they spend an hour with my nurse. I've got 2 amazing practice nurses who, one of them came with me to this conference last year. She said they couldn't come this year, they're both doing uni degrees and they're flat out, but they're 2 amazing young women, and they have taken up the ball and run with it really with low carb. They do a lot of coaching with the patients. They're hugely supportive of me professionally. We ran low carb Cairns a couple of weeks ago with Rod's expert guidance, and the 2 girls did so much of the organising and helped me out with that. They run a Facebook group for our patients so that our patients can communicate with us and get a bit of help and support. And then once we've got patients on the programme, we bring them every week for a weigh-in and a chat, and then when they feel confident, we bring them fortnightly, and then when they feel a bit more confident, they come monthly. And when they feel they've reached their goals, when they've got to where they want to go, when they've got their weight down, they've got their diabetes under control, we give them their wings, and we have butterflies on the wall in the nurse's room to entertain the children. So we write their names on the back of a butterfly. And the patients who've done the programme and have met their goals and left happy become butterflies, and they have their memory. They can always come back. It's not a shut door. But it just symbolises that they've actually achieved something that they set out to achieve, which has been so useful.
So that's pretty cool. Like you're running an actual weight management program out of the practice. I guess you're formally enrolled in it as such.
Yeah.
And you choose to do that. How long does that run for?
As long as the patient wants to do it.
Yeah.
It's not a 3-week, 12-week, 6-week. No, they can come for as long as they feel they want to, until they've met their goals. And patients, we encourage them to set non-scale related goals that dress they want to get into, or to feel better. Or one lady came with her goal, she just wanted to get rid of her knee pain, because it was really, really troubling her. And it took 6 weeks to get rid of her knee pain. She quite liked coming to see us, and she'd lost about 6 kilos in that time. But she came, over 12 months, she lost 35 kilos. And she started walking all the neighbours' dogs for them. She's now friends with all the neighbours because she walks their dogs.
Well, they should be walking their dogs themselves, frankly, but there's a... yeah, right, that's true.
So everybody has different goals. Everybody's coming from a different place, and everybody's going in a different way. So really my job is to be there to facilitate them and guide them to do that, and help them with whatever. Some people like counting carbs, they get it, they want to count carbs. Other people don't want to. Some people will bring a food diary with every last item written in every week. Other people always forget their food diary. So, it's very much about being an individual basis for patients. I'm now getting lots of referrals from other GPs in the town. So they're GPs who are certainly not sceptical about low carb. They're very supportive of the patients that want to do it. They send them to me because they still feel a little bit frightened to do it themselves. But I want to try and encourage them, and then we'll try and, I think our next plan, we've made a plan this weekend, is to try and have a group of low carb doctors in Cairns so that we can meet. It's a small place. We should be able to meet and try and encourage more of our colleagues to
join in.
Yeah.
So there's a couple of interesting things I just want to explore a bit further. First is you talked about your practice nurses, and I've talked to a lot of nurses at this meeting and others who are concerned about going outside of their scope. They're really doing a health coaching role now rather than just a practice nursing role. How's that gone, and how did they get to that point where they were comfortable doing that?
It took no time at all. They were keen. They wanted to do it. They saw what I was talking about, and then they tried it themselves, of course, because they both had babies and they both wanted to lose weight, and they found that the weight came off very quickly. And they're young and they're fit, and they'd only put on a small amount of weight when they were pregnant, so they hadn't had long-term obesity. Of course, the weight came off them very quickly, which was very powerful, and they were enthused about being part of it.
Cool.
And in fact, after the Cairns conference 2 weeks ago, people who were at the conference, and it was largely a non-medical audience at the conference actually, we had a few doctors, but not very many, it was mostly public, and they wanted to form a low-carb community group in Cairns. So we formed a low-carb Cairns Facebook group for the Cairns community. And yesterday morning, I saw on Facebook that they'd all decided to meet. So this wasn't me, this was one of the people that was there. So she organised a meeting, they all met in a local cafe, and one of the people who is a coach, he's actually a police officer, he gave an impromptu chat about...
Parking.
Glucose burning to keto burning, and there was a convenient whiteboard in the cafe, and apparently they had a great morning. They put it on Facebook yesterday, and they're planning another meeting in a month.
So what is the role of and we've used these ourselves quite a lot in general practice, is what is the role of social media and the good use, because it's obviously got a good role.
Oh, it's huge. I think it's fantastic for encouraging grassroots community. I mean, the more patients, the more people we can get involved with this, the more they're going to disseminate it to their friends. They're then eventually going to have to go back at some point and say to their doctor, look, I've lost 20 kilos. And doctors, some of them certainly will take notice of that. They will notice that the patients are saying, I feel better, I've stopped my diabetes medication, doc, and all those sorts of things. And I think we have to try and encourage a grassroots movement. I don't think the way the politicians are at the moment that they are ripe for change. I may be wrong, but they don't strike me as being ripe for change. They only consider the next 3 years till they get to the next general election. They consider the party funds, and the biggest contributor calls the tune. So what we have to do is do it in a different way, and I think we have to disseminate this from the bottom up. And if everybody in the country starts eating low carb, the politicians have no choice but to take notice.
Yeah.
So we've got to spread it out from the underneath, I think.
Okay, cool. Thank you. I was under the impression that the political cycle in Australia was 8 months, but that's...
That's just Prime Minister.
what we're going to do now is we're going to work across and just each GP here is going to pick out a case, and it's going to be something different than what we've heard from diabetes and that sort of thing. So who wants to kick off? Do you want to start that, Victoria?
To be honest, I can't think of one particular case, but there's many. It's mental health benefits.
Yeah, mental health. Let's talk about mental health, anxiety and depression in particular.
Yeah, I see a lot on the Northern Beaches, and particularly the late teenage girls. They're all iron deficient and going crazy on vegan diets. And I put them back on at least eggs, nothing else.
So what's your approach with that? Because my experience talking to teenage girls, which is limited, is that when they're convinced about a vegan diet, they're very convinced.
Yeah, well, I mean, they don't feel very well, all the ones I see. So, I mean, once their iron level's restored, if they're still feeling unwell, it's always diet related. And, I get them to obviously go ask them what they eat. And we talk a lot about, I talk a lot about the birthday party effect on kids. And so we all know that toddlers go crazy and kids go crazy at birthday parties. And I'm like, well, there's no different for you as a teenager, and you're having these great acai bowls that look amazing on Instagram, but they're really not good for your mental stability, and they get it. They're not. They do get it. So I just chip away one patient at a time. Yep.
Jackie?
I suppose a case that's a little bit different that comes to mind is I found it all pretty interesting with the whole. And I'm still trying to decide exactly what I think about it, is the carnivore diet and using it in kind of funny medical conditions that haven't responded well to traditional medical therapy. So I've been dabbling a little bit in that to a degree. And sometimes these people, will seek me out and are highly motivated to make some changes and, are, suffering from bad, health at the moment for whatever reason. And so one case is a lady who was in that situation, just funny, strange, vague symptoms, bloating, tiredness, but really quite debilitating to the point that she wasn't able to do the things that she was previously doing, like her level of exercise and work. So it was really quite debilitating. And I put it to her to try a version of the carnivore diet. And
hang on, so just backtrack a bit. So here's a former dietitian, now GP, and they come in to see you and they leave with a prescription of eating only nothing but meat. What do you make of that?
I know, and I say to them, this might sound a bit crazy, but a lot of them have kind of been looking at things in this space, and so some of them I might suggest that to her. They're not completely knocked over, but yeah, it is quite a change to obviously the education we received.
And you're seeing it as a sort of the ultimate elimination diet in that sense. If there's an autoimmune response and an issue there, then you're getting rid of pretty much everything that's likely to do that whilst you can still stay with enough nutrition.
Yeah, that's how I see it, and I ultimately have the goal to try and have the goal to reintroduce foods in an order of how likely they are to react to them. So that's usually my ultimate goal. So yeah, that's the way I approach it. So I'll kind of talk them through that. And in this one particular case, she's had great benefits of doing a period of the carnivore diet, and I have, for my own anxiety, tried to say, well, maybe we'll start introducing some, foods that are less likely to cause problems. And this patient is just like, well, I have no craving for any other foods. And so I'm like, okay. So, ultimately, the end of the day, the patient's going to do what they're going to do. But it was certainly an interesting kind of vague medical things that you can't really put into a box. Had seen a few different doctors and even some specialists, tried a few different medications and hadn't had much benefit, and was highly motivated. And in that situation, I see the risk benefit weigh up as fairly favourable, whereas if someone, it's like not even on their radar, and if you're suggesting to go on a carnivore diet and to them it's going to be highly restrictive and stressful, then yeah, that risk benefit probably goes slightly in the opposite direction. So, yeah.
Cool. Thank you. That was interesting, wasn't it? What do you got for us, Joe?
Yeah, look, probably the one that comes to mind was a lady who came to see me, as I do get from time to time, people coming in, I suppose, for second opinions. That, heard me on the radio or something. You must know stuff because you're on the radio. Well, it's not quite like that. Previously been diagnosed with polycystic ovarian syndrome and was wanting to lose weight, and had already basically started to put herself onto a ketogenic type of diet, and really wanting to see, well, what was their baseline. And I think she'd come to see me because she's had a discussion with her usual GP, who really wasn't sort of, I'm not sure it was dismissive, but anyway, she didn't get the vibes. Look, that's fine. I mean, this was, in some respects, from my end, relatively straightforward, because she was already starting down this path. We had a bit of a chat about what it might look like, what was her goals, and she was wanting to lose some weight over the period of time. I said, look, why don't we get some baselines? We'll get some hormone levels. We'll get your glucose, your fasting insulin, your liver function. Look, we won't, drain your blood, but we'll get some key things. And probably the most critical one out of all of it, she had a fasting insulin of 44. Normal, for those who don't know, sort of up to 20, and people argue that even sort of as soon as you're in double digits, you're drifting away from where you should be. Her actual glucose was normal, which means that if you do a test for diabetes, it's going to come up clear, but the fasting insulin was pointing us in a direction. So anyway, she went off and was continuing a keto diet, and we had a bit of discussion again about how to stick to it and the like. And we did some follow-up bloods 3 months later, and the fasting insulin's fallen to single digits. I can't remember off the top of my head if it was 7 or 8 or 9, but it was in single digits, and that was after 3 months. Now, maybe it was lower after 4 or 6 weeks, I don't know, but by the time she'd come back, she'd lost around about 15 kilos. She wants to proceed further with it, but the fact that what was going on the scales, what was going on in terms of the number of notches on her belt, the dress size, and in particular, I suppose, was the ability to say, well, look, here was your insulin 3 months ago, here is your insulin now, even though your sugars were quite normal, and nobody would have said even that you were, on standard testing that you're even pre-diabetic. We've sort of sent you, here's your fork in the road. Instead of going down this inexorable path to type 2 diabetes, you've gone down a different path, which is to not go down the road to type 2 diabetes. So, look, she was very happy. We'd left that she would continue on her path, and we'd see her again in about 3 months, which I think will be November or thereabouts.
Cool. Thank you.
So I've got 3 cases that are all kind of the same, and they illustrate a potential side effect of a low carbohydrate diet, particularly if you're under the age of about 40, 45, and you're female. So I had one lady who had a toddler and had put on a lot of weight in pregnancy and had a lot of mental health issues afterwards, and came to see me because she wanted to lose weight, which she successfully did. She lost about 20 kilos. With a low-carb diet, and then came in to tell me that she was pregnant again, which she was delighted about because she'd been trying for a baby. I had another young woman who had her baby had a very traumatic delivery and had made up her mind she wasn't having any more children. She was very overweight, and she came to see me wanting to lose weight. So we put her on a carbohydrate diet, and 6 weeks later she came in and she said, "Dr. Sue, you've made me pregnant!"
Oh, is this a side effect?
This is a side effect of a low-carb diet. It's your fertility. And I've had another woman who also came in and went on a low-carb diet because she hadn't been able to get pregnant. She was young. She'd been struggling to get conceived. She was very overweight. She went low-carb. About 3 months in, she was 10 kilos, something like that down, and she came in delighted to tell me she was pregnant. So at least on 2 of the occasions, they were planned pregnancies. The third one was a total side effect. She had no intention of having another baby. But a baby's due in about 2 months' time now. She's very happy now. She's kind of tempted. But I think it's an important lesson that if you have young female patients that you're putting on a low-carb diet, if they don't want to get pregnant, for goodness sake, make sure they've got adequate contraception. Putting them on a low-carb or ketogenic diet improves their fertility. And many of them, particularly if they've been struggling to conceive, either because they've got PCOS or just because they're very overweight, they will get pregnant. So it's fine if they want to, but just be mindful if they don't want to.
What about male infertility? Because that's very much on the increase.
I think you're right. It's on the increase. I haven't got any data, and I haven't had any male patients specifically come to see me to lose weight because they were trying to achieve a pregnancy. But it may be. I don't know. I I find with quite a lot of them, maybe it's because I'm a female GP, I see a lot of women, and interestingly, a lot of them go home and put their husbands on a low-carb diet as well, because that's more convenient for catering. And what really irritates them is that men always lose weight quicker, which I really hate. And they sit there saying, well, look how slim my thighs are. But yeah, they don't, maybe they didn't know that there was a male infertility problem because it hadn't been investigated, and the couple had an infertility problem, but got pregnant and it was assumed because she lost weight. I don't know, I'd have to look up.
We certainly know that, there's research out earlier this year that in the opposite thing, that one of the Ventus studies that showed that the vegan lifestyle in that group was associated with the lowest quality of sperm and the slowest swimming ones. So diet affects that.
You need cholesterol to make sex hormones, so it's not really surprising.
Yeah.
If you don't eat any cholesterol, you're not going to have any sex hormones. So.
That's probably a good thing then.
Right, we're actually past our time. So on that note, can you join me in thanking these 4 wonderful low-carb GPs?